So with regards to this pilot, our first steps began several months ago, meeting with key members of Millennium's team and identifying what those best practices would be for our asthma and COPD patients, what we were looking to achieve and gain out of this pilot. So we've been meeting for several months. At this point, we did a lot of planning preparation for our go live date of July 1st of this year. So although we're only 2 weeks into the actual pilot, we've been working and putting ourselves together and what we need to do. Some of those things we had to do were getting more reliable spirometry machines in our practices. So we now have those. Obtaining training for our providers, we've gotten that from Millennium. And at this point now we're making sure that we have our list of all the patients that we see. We're tracking them daily with pre-visit planning reports, identifying which patients are coming in each day that have a diagnosis of asthma or COPD, that we're making sure they have the spirometry done, that we're making appropriate referrals, that we're identifying any potential gaps in care, which would be like, did they receive their flu vaccine? Have we offered them the pneumovax vaccine? Any of those things, are we providing any kinds of medications to the patients? These are all tracked on the sheet that we're doing every month. This allows us to really plan for what the expectation is. Further on in the project, we'll also be working on creating like goals for these patients that have asthma or COPD. And these goals are like an action plan, so that if something were to happen, we want to prevent that ED or hospitalization visit from occurring. We want them to know, hey, these are the steps you take, that we came up with this action plan together, you with your provider, of what you would do so that we can prevent that emergency room or hospitalization from occurring. So these are where we're going with this project, and hopefully with the backing we have from Millennium, that we can achieve really great outcomes for our patients.